Hello and welcome to Clinical Cases. Today we're going to be taking a look at Foundation Block Part 2, which will involve us taking a look at some clinical cases including Marfan syndrome, some embryological malformations, Down syndrome, ADHD and autism. So let's start by taking a look at Marfan syndrome. Marfan syndrome is a disorder of the body's connective tissue, and if you remember that connective tissue is a group of tissues that maintain the structure of the body and support our internal organs. The causes behind Marfan syndrome is hereditary, which means it's passed on to a child from a parent who's been affected. And in around 3/4 of cases, Marfan syndrome is inherited from one parent. The syndrome's autosomal dominant, which means a child can inherit it even if only one parent has the syndrome. And then therefore there's a 1 in 2 chance that the child of a parent with Marfan syndrome will inherit the syndrome. The symptoms associated with Marfan syndrome include tall and slender build, disproportionately long arms, legs and fingers, a sternum that protrudes outwards or dips inwards, a high arched palate and crowded teeth, heart murmurs, extreme nearsightedness, abnormally curved spine and flat feet. But do remember that symptoms vary from person to person. Some people might have very severe symptoms whilst others have very minor, and others may have only a few of these symptoms while others have all of them. In terms of a treatment and management, most people with Marfan syndrome have problems with the heart and blood vessels, such as a weaker part of the aorta, and therefore the aorta can tear or rupture. So treatment usually requires more than one clinician, as there are several varied symptoms with Marfan syndrome, and they all require different treatment and management. The priority tends to be focused on this aorta and the weaker part of it, and management around that to ensure that nothing happens there, so there's no thoracic aortic dissection, because that is the most common cause of death with Marfan syndrome. Next we move on to embryological malfunction, so we look at gastroschis and esophageal atresia here. So esophageal atresia is a rare birth defect that affects the esophagus. The upper part of the esophagus doesn't connect with the lower esophagus and stomach, and therefore it usually ends in a pouch, and we describe this as a blind-ended pouch. It often happens alongside another birth defect we call a tracheoesophageal fistula, which is a connection between the trachea and the lower part of the esophagus. This is usually cured by an operation to repair the esophageal atresia pretty soon after birth, because obviously no feeding can take place whilst it's a blind-ended pouch. The baby will be taken to neonatal intensive care where they're given a general anaesthetic. And this shows the different types of esophageal atresia and tracheoesophageal fistulas, just to give you an idea as to what's going on in this condition. Gastroschis is a birth defect of the abdominal wall, and it occurs in approximately 1 of every 2,000 live births, which is therefore a very common congenital anomaly. The intestines of the baby are found outside the body and exit through a hole beside the belly button. The hole could be small or large, and sometimes other organs, such as the stomach and liver, can also be found outside the body in this sac. It occurs during pregnancy, when the muscles that make up a baby's abdominal wall do not form correctly, and a hole occurs which allows the intestines and other organs to extend outside the body. It's important to be aware of this condition and other conditions that are similar, such as non-phthalocele and Meckel's diverticulum, and it's important to be able to differentiate between them. Cystic fibrosis is the next condition we're going to talk about, and this will be covered in much more detail in the respiratory block. So cystic fibrosis is an inherited condition in which the lungs and digestive system can become clogged with thick, sticky mucus. It can cause problems with our breathing and the digestion from a very young age, and over many years the lungs become increasingly damaged and may eventually stop working properly. The symptoms of a patient with cystic fibrosis include a recurring chest infection, difficulty putting on weight, frequent wet-sounding coughs, diarrhea, occasional wheezing and shortness of breath. So treatment and management. Antibiotics are used to prevent and treat chest infections. Medicines to make mucus in the lungs thinner and easier to cough up. These are called mucolytic drugs, and we'll talk about these a little bit more in the respiratory block. Medicine to widen the airways, so bronchodilators, and also to reduce inflammation, so antihistamines and anti-inflammatory drugs. Clear mucus from the lungs, and prevent malnutrition with a special diet. Cystic fibrosis is caused by a faulty gene that a child inherits from both of their parents, so therefore it's an autosomal recessive condition, and therefore it happens when a carrier parent meets another carrier parent. as you can see here, 2 carriers in this pedigree tree are meeting, and when they reproduce an offspring, one of them here has suffered from cystic fibrosis. There are 2 carriers and 1 unaffected child. The faulty gene affects the movement of salt and water in and out of cells in the lungs, and this, along with recurrent infections, can result in a build-up of that thick, sticky mucus we were just talking about. And to be born with cystic fibrosis, a child has to inherit, as we've said, 2 copies of this faulty gene from both parents that are carriers. We'll talk a little bit more about cystic fibrosis in the respiratory block and the impacts that it has on both the lungs and the gastrointestinal tract. Next we have Down syndrome, which essentially is trisomy 21. It's a genetic condition that typically shows some level of learning disability, but again, the symptoms vary depending on the individual patient. It's most commonly caused by non-disjunction of chromosome 21, which we'll talk about a little bit more in a moment. However, there are other causes as such. So Down syndrome is usually caused by an extra chromosome within a baby's cell. In most cases, this isn't inherited, it's simply the result of a one-off genetic change in the sperm or egg. There's a small chance of having a child with Down syndrome with any pregnancy, but the likelihood increases with the age of the mother. Other risk factors include having a previous child with Down syndrome, or having a parental karyotype with a translocation. So explain a little bit what that means in a moment. Those patients with Down syndrome have an increased risk of heart disorders such as congenital heart diseases, hearing and vision problems, thyroid problems such as an underactive thyroid gland, recurrent infections such as pneumonia, and Down syndrome increases the risk of all of these conditions. So what's noticeable when you look at a patient with Down syndrome? They often have a shorter stature than others, with lower ears on the face. And often as well they suffer from learning difficulties, but this can vary from individual patient to patient. I've labelled this section the 3 reasons behind Down syndrome because it's the 3 main causes as such of Down syndrome. So the first one is trisomy 21, and this is the most common kind of Down syndrome, accounting for around 95% of cases. And this is where every cell in the body has an extra chromosome 21. And it's not a hereditary condition, it's a one-off occurrence. Mosaicism. This occurs in around 1 to 2% of people with Down syndrome, and it's a result in a milder level of intellectual disability and less obvious physical characteristics to other forms of Down syndrome. The other form of Down syndrome is translocation, and this is one of the few types that is likely to have a hereditary impact. So this is part of chromosome 21 being broken off and then attached, and this is translocated. Translocated just means a part of a chromosome is broken off and attached elsewhere. So part of chromosome 21 is broken off and attached onto a different chromosome. This form of Down syndrome is uncommon, occurs in around 3 to 4% of cases, and it usually attaches to chromosome 13. Like I say, it's the only one with a bit of hereditary background to it, and it'd be good to look into all of these more in your own free time. Next we'll have a look at ADHD, which is Attention Deficit Hyperactivity Disorder. It's a group of behavioural symptoms that include inattentiveness, hyperactivity and impulsiveness. The exact cause is unknown, but the condition has been shown to run in families. The 3 symptoms include inattention, hyperactivity and impulsivity, and these tend to be the triad of symptoms that you commonly see in an ADHD patient. Here we've listed some potential causes, so not necessarily definite causes, because being born prematurely does not necessarily mean your child will have ADHD, but it may increase the risk, as will having a low birth weight, if the mother smokes, drinks alcohol or abuses drugs during the pregnancy, and it's thought that around 2 to 5% of school-aged children may have ADHD, so the prevalence is actually a lot higher than you would imagine. Lastly for this video we just take a quick look at autism, because it's a good condition to be aware of. Although you'll learn about it more in the future, it is a good condition to be aware of at this stage. So more boys are diagnosed with autism than girls, and the autism spectrum disorder is the name for a range of similar conditions including Asperger's syndrome that affects a person's social interaction, communication, interests and behaviour. The symptoms are present usually before 3 years of age, although a diagnosis can sometimes be made after the age of 3. So they tend to have issues with social interaction and communication particularly, and in early infancy some children with ASD don't babble or use other vocal sounds that you'd expect of a child of that age, and therefore we may detect this by a child missing key milestones of growing up. So the causes behind this, again, the exact cause is unknown, but it's thought that several complex genetic and environmental factors are involved and combined to cause this condition. In the past, some people did believe that the MMR, measles, mumps, rubella vaccine caused autism, but this has been investigated and researchers have found no evidence of a link between the two. With regards to management, we can't say there's a cure to autism, however it is treatable and therapies are used to improve the quality of life from an early age. So really, physicians should use an MDT, a multidisciplinary team, in order to build a good treatment plan. And this should be built on the child's interests, offer a predictable schedule, teach tasks as a series of simple steps, actively engage the child's attention, provide regular reinforcement of behaviour, and involve the parents. And if that's followed, hopefully a regular routine, the child with autism will be well integrated into society. That's everything for this video. I hope you found it useful, and if you do have any questions, please feel free to contact me. Thank you for listening.